Hello and welcome. Today we'll be diving into a serious and often devastating condition, bladder necrosis. This video will cover everything you need to know, from the causes and symptoms to diagnosis and treatment options. We aim to provide clear, concise information about this complex condition. So, what causes bladder necrosis? The primary culprit is a lack of blood supply, known as ischemia. This can result from several factors. Severe urinary retention, where the bladder becomes overly distended, can compress the blood vessels feeding the bladder wall. Pelvic surgeries, particularly those involving the bladder or surrounding structures, can inadvertently damage these vessels. Radiation therapy to the pelvic area, often used in cancer treatment, can also damage blood vessels over time. Finally, certain medical conditions like advanced atherosclerosis or diabetes can contribute to poor blood flow and increase the risk of necrosis. Now, let's explore the pathophysiology of bladder necrosis. When blood supply to the bladder wall is compromised, cells are deprived of oxygen and nutrients. Initially, this leads to cell injury. If the ischemia persists, this damage becomes irreversible, leading to cell death or necrosis. The dead tissue loses its structural integrity. In severe cases, the bladder wall can rupture, leading to peritonitis, a life-threatening infection of the abdominal cavity. The extent of necrosis determines the severity of the condition and significantly impacts treatment options. Unfortunately, precise epidemiological data for bladder necrosis is limited because it's often a secondary complication of other conditions. However, we know certain populations are at higher risk. Individuals with a history of pelvic surgeries, especially bladder surgeries or radiation treatment for pelvic cancers, are more susceptible. People with chronic conditions like diabetes, peripheral artery disease, or advanced atherosclerosis also have an increased risk due to compromised blood flow. Additionally, elderly individuals are generally at greater risk due to age, related changes in blood vessels, and overall health. Recognizing the signs and symptoms of bladder necrosis is crucial for early diagnosis and treatment. Common symptoms include severe pelvic pain, which can be constant or intermittent. Blood in the urine, known as hematuria, is another frequent sign. Inability to urinate, or anuria, may also occur. Fever, chills, and signs of sepsis indicate a serious infection resulting from the necrotic tissue. Left untreated, this condition can rapidly deteriorate, leading to life-threatening complications. Diagnosing bladder necrosis requires a thorough evaluation. The process usually begins with a detailed medical history and physical examination. Urine tests, including urinalysis and urine culture, help identify infection in blood. Imaging studies, such as CT scans and MRIs, are crucial for visualizing the bladder wall and assessing the extent of necrosis. Cystoscopy, where a small camera is inserted into the bladder, allows direct visualization, and tissue biopsies for pathological confirmation of necrosis. While there aren't distinct types of bladder necrosis in the same way you might classify a cancer, it can be categorized by its extent and severity. We can talk about focal necrosis, where only a small area of the bladder is affected, versus diffuse necrosis, which involves a larger portion or the entire bladder. The severity is often gauged based on the depth of tissue damage and the presence or absence of complications like bladder rupture or sepsis. The categorization directly informs treatment decisions. Treatment for bladder necrosis depends on the severity and extent of the condition. Initial management often involves intravenous antibiotics to combat infection. Catheterization is typically required to drain urine and relieve bladder distension. Surgical intervention is usually necessary. Options include partial cystectomy, where the necrotic portion of the bladder is removed, or a complete cystectomy, where the entire bladder is removed. Following a complete cystectomy, urinary diversion is required, which involves creating a new way for urine to exit the body, such as through an ileal conduit or a continent urinary reservoir. Preventing bladder necrosis focuses on managing the underlying risk factors. For individuals undergoing pelvic surgeries, meticulous surgical technique is crucial to minimize damage to blood vessels. For those receiving radiation therapy, strategies to reduce radiation exposure to the bladder can be employed. Strict control of blood sugar levels in diabetics is essential. Early detection and management of urinary retention can prevent bladder overdistension. Finally, lifestyle modifications to promote cardiovascular health, such as a healthy diet and regular exercise, can improve blood flow and reduce the risk. The prognosis for bladder necrosis varies significantly depending on the extent of necrosis, the patient's overall health, and the timeliness of diagnosis and treatment. Early diagnosis and prompt treatment generally lead to better outcomes. However, even with treatment, complications can arise, including chronic pain, urinary infections, and the need for long-term urinary diversion. Recent research has focused on improving surgical techniques to minimize blood vessel damage and developing new methods for urinary diversion that improve quality of life. There is also ongoing research into using hyperbaric oxygen therapy to promote tissue healing and reduce the extent of necrosis. Thank you for joining us today to learn more about bladder necrosis. We hope this information has been helpful.